Looking to elevate your COMLEX prep? Dive into RemedyOMM.com. Discover our comprehensive question bank, expert lectures, and personalized consultation services, all tailored for your success. Join the community of achievers. Visit RemedyOMM.com today and take the next step in your medical journey.
Hello everybody, welcome back to Remedy OMM. Today, we'll be going over everyone's favorite topic, Chapman's points. Simply put, Chapman's points are reflex points that represent visceral dysfunction. They are small, palpable nodules usually found in deep fascial tissues or even on superficial bony landmarks. Knowing that description of a small, palpable nodule is high yield, as questions will ask you what tissue texture changes one would expect. You may also find them described as gangliform contractures. Chapman's points can be found both anteriorly and posteriorly. For example, the anterior Chapman's point for the appendix is found on the tip of the 12th rib, while the posterior Chapman's point for the appendix is located at the right transverse process of T11. The reason I highlighted the tip of the 12th rib is because this is probably the highest yield point to memorize. The posterior points are treated first, and when palpating, the patient will usually feel a sharp, non-radiating, and exquisite pain. And here they are, all the points you have to know, both anterior and posterior. Unfortunately, there's really no other way to know these besides memorizing them. I'll do my best to highlight the most high yield points in the next slide, but I highly recommend putting the time in on practice questions so that you can recognize which points tend to come up over and over again. The highest yield point, without a doubt, is the anterior Chapman's point for the appendix, which is located at the tip of the 12th rib on the right. This comes up time and time again on practice questions. They'll give you a clinical case where a patient is presenting with signs and symptoms consistent with appendicitis, and they'll ask you something like, what physical exam finding would you expect to see? And it'll describe an exquisitely tender, palpable nodule on the tip of the 12th rib. Other high yield points to know include the adrenals, which are located 1 inch laterally and 2 inches superiorly to the umbilicus. The anterior Chapman's point for the kidneys is 1 inch lateral and 1 inch superior to the umbilicus. This makes anatomic sense, as the adrenals sit right above the kidneys, and so that it makes it easy to remember. And in line with the genitourinary system, the bladder is located at the umbilicus. I would say that these are the highest yield points to know. For the colon, an easy way to remember its anterior Chapman's points is by taking the colon and flipping it over vertically onto the femur and IT bands, as you can see here in the picture. The parts of the colon line up anatomically, just flipped upside down. It's an easy topic to understand, but it's a lot to memorize and most likely not worth your time memorizing every point. Try your best to memorize the highest yield points that I've highlighted. In addition to that, doing practice questions will help you see patterns of which points they like to highlight the most. Thanks again for watching. We'll see you guys in the next lecture.